All right, welcome back. Day 25 of the 27-day mobility challenge here at the Reprogram, and we are continuing on with these essential range of motions, these prerequisites that we need to maintain healthy, happy joint movement, whether it's doing a physical training program, maybe you have a practical job like a tradesman or construction, and just day-to-day activities. This is the range of motion that your body is designed to have and to keep. Okay, and as I said before, it can be the difference between a muscle strain and a complete tear. Okay, so today we're going to go into hip internal rotation, and this comes off the back of external rotation, which we did yesterday quite well because these two are linked together. All right, so when we talk about hip flexion, like we did at the beginning of the lower body series, we like to see, particularly in that bottom squat position or lifting my knee up as high as I can, I need that external rotator lengthen the hip to maintain that joint centration, and also when I'm using it as a passive joint range of motion, i.e. when I'm sitting at the bottom of the squat, I need that external rotation to clear that hip space to sit in that pocket, what I like to call that hip pocket. Now, with hip extension, we need that internal rotation just as much because it maintains that hip centration as the leg goes behind the midline. So when we're walking, running, sprinting, jumping, whenever we're extending the hip internal rotation is really important because it maintains joint centration and hip function, basically. And we have these signs that we can notice on people who haven't extended the hip for a long time. They maybe, like we've been sedentary. We use that as a common theme. Sitting at a desk, sitting at a computer for a long time, being inactive. When we lose one, we usually lose the other as well. So just like if we minimize hip flexion, we get tight in the posterior chain, we're going to lose that external rotation ability as well. And then with this one, when we lose the ability to extend the hip, we also suffer with hip internal rotation as well. So it's never happens solely on its own. We usually lose a bit of the main extension, flexion, adduction movement first, and then the rotation or the lack of rotation comes in afterwards. So what does a lack of internal rotation look like? Well, when we walk, or even just standing still, if we're missing that internal rotation, we'll stand in like a duck feet position, so our toes turn out, our knees point out, the legs can look bowed sometimes. And it happens like this because when we don't have that internal rotation in extension, the external rotators are already short, hence why we don't have the internal rotation space. They're already short, which means our glute max and our glute medius aren't functioning properly, which means they're going to get inhibited, and then we're just relying on those external rotators for extension, like we said yesterday, and that has a compounding effect when we actually bring the leg up in front of us. So we've reduced that internal rotation capacity, but also now we can't actually keep that joint, the ball in the acetabulum, in a neutral position through extension because the external rotators are pulling on it. So we can't, what happens is that it just grinds on the posterior side of the labrum, and it's a big reason why people get labral tears, hip impingement, and also onset, with athletes particularly, onset osteoarthritis, early onset osteoarthritis. When we talk about actually going into the athletic endeavors, if you're part of a sports team or you're playing with your kids or you're trying to be as active as they are, be that hero dad. When you're in that frontal plane and you're trying to change direction quickly, when our foot's facing forwards, I need that space to be able to rotate the body into. If you imagine like a golfer taking a swing of the ball, when he swings into that supporting leg, he needs adequate internal rotation in that hip to maintain that foot facing forward as the body twists. All right. Now, some of that, I'm not saying you need as much internal rotation as a golfer has on that leg, but particularly you guys who play golf or are retired or whatever, and it's quite an activity for you, we usually only use one stance leg to do that. You don't swing the other way. So we end up with these asymmetries, these torsion going across the SI joint, the back, which leads to chronic back pain. But also we end up getting an internal rotation deficiency, and you'll notice that particularly in that frontal plane where you do day-to-day things like stepping in and out of a car. Getting in the car is worse because you need more hip internal rotation because of the hip flexion angle to actually slide your body in sideways, okay? And that same mechanism comes into effect when you're trying to change direction quickly playing sports, right? So if we're running forwards and I have to suddenly change direction to go sideways, I need to be able to absorb and maintain my feet facing forward. I need to absorb that that forced transition, slightly have enough room in the hip to rotate into it and then rebound off it using those abductors. And they need that joint centration to actually work effectively as well. So today we are going to go through a modified version of the FADIR test, which is flexion, adduction and internal rotation, which is the traditional test. We're going to modify it and I'll show you how to do that now. All right, this is the modified version of the FADIR test, flexion, adduction, internal rotation, the traditional physical therapy test where we would use it to diagnose symptoms of femoral acetabular impingement, hip labral tears, or SI joint pain. Okay, and this is what the modified version looks like. So you're just going to sit on the floor, and this is actually quite common. So you might have seen this in certain sports or sporting clubs or the gym, but this is the one we use because it's a great screening tool. So you are going to basically sit on the floor like this, hands behind you in a comfortable support. And what I do is I say, bring your feet out as wide as is comfortable, and then you're going to turn your feet out a little bit. Okay, now, as it happens, my feet are actually in line with my hands, so that might be a good coaching cue for you. Now the goal is to internally rotate the hip and get the knee to the floor without excessive hip lift or twisting, or pelvic hip lift and twisting throughout the movement, okay? So this is what a pass looks like. So I'll get into position, feet turned out, and I basically bring the hip down, drop it to the floor, and back up, okay? Drop the hip down to the floor, and back up. Do the other side, and back up. You'll always have a preferred side. Everyone's always got a dominant side where they're slightly more mobile, got slightly more internal rotation, but this is the reason why we do it. So we look for asymmetries and try and equalize them out as much as possible to maintain balance across the spine, okay, or the SI joint and the lower back. All right, so again, bringing that knee down, touching the floor, and bringing the knee down, touching the floor. Now, that is a pass. A fail would look like a few things. So if I was going to bring the knee down and I didn't have that rotation to even get my knee down to the floor, it kind of turns into a full body movement. So it looks like this. As I get down here, I've run out of internal rotation, and I have to externally rotate this leg and twist my whole body down to get that knee down to the floor. And then we can see through this process where that lower back is being being compensated for, is where that lower back is compensating for that limited internal rotation. So we can see where that pattern is happening and at what point, what angle. Okay, so that would be a fail, or not even trying to stay strict and not even getting to the floor would be a fail, or even twisting this upper body as well, like I said, like this full global rotation and twist of the body. Okay, so this would be a fail. All right. Okay, so the goal is to keep these hips independent and the rest of the body still. Okay, so that is the test. If you like what you're hearing, you like what I'm doing, and you want to find out more and how I can help you, go to www.thereprogramonline.com. Thanks for listening. See you tomorrow. Check this out.
Hi there, I'm Andrew Graham, founder of the Reprogram Online, and if you're here, it's likely because you are feeling the frustration of a body that just isn't performing the way it used to. Maybe it's a nagging joint pain, the frequent injuries, or the simple truth that despite all your efforts, you're not seeing the results you desire. As a busy professional, I understand how valuable your time is. You want a body that not only performs well, but one that you can enjoy and that you know is capable of handling whatever life throws your way. Yet, finding the right path in today's fitness industry is like navigating an untamed jungle of misinformation, quick fixes, and empty promises, often leaving you frustrated or worse. That's why I created the Reprogram, a comprehensive training system designed to not only build a strong, athletic physique, but to do it in a way that prioritizes injury prevention, joint health, and longevity. By merging concepts from physical therapy and strength and conditioning, the Reprogram targets and alleviates the very issues that are keeping you from moving forward. Starting with our free mobility assessment, we will identify these issues, as well as your potential risk of injury, and design your training program based on your results. You see, many people think they need more, but often what they really need is better. It's not about lifting the heaviest weight or doing endless reps. It's about focusing on what truly matters so that you can build a body that's not only aesthetic, but resilient. A body that works with you, not against you. The Reprogram is built for men who understand that their body is their most valuable asset and who refuse to let joint pain and past injury dictate their future. Using the 3-stage training system, you'll regain your mobility, correct muscle imbalances, and improve your posture, all with minimal equipment. I mean, imagine a life where you're not just managing pain, but actually eliminating it and getting stronger every day. Believe me, I understand the frustration of trying to stay active when your body seems to resist every step. But with the right approach, that frustration can quickly turn into fuel for change. The Reprogram is designed to respect your time and deliver results in a way that actually teaches you about your body. So, are you ready to break the cycle and unlock your potential? Then I invite you to start your journey today. Remember, this is about you, investing in your future, your health, your quality of life. Click the Get Started button to begin your free mobility assessment. I'm Andrew Graham, and I'm here to help you banish pain, optimize mobility, and unleash strength one step at a time. Let's get started.